up, everybody?
Hey.
Welcome.
Wait a minute. I was trying to get it ready for it to share on my platforms. Hey y'all.
Hey, what's up, everybody? Welcome to By Any Means podcast. Oh my goodness, I am one of your hosts, Ryan Jones.
And I am Sharita Walden. Y'all know what I do every time I get ready to get on. I have to share it on all my platforms. So what we're doing is taking a second to share, like, share, and subscribe. If you are on YouTube, please go ahead and subscribe so that you can get the alerts that this is happening. I've got people saying, "Hey, I missed it. I missed it." I'm like, "Well, you can go back and watch." But how cool is it to be in the real time with us, engaging with us while we have these conversations? So please share if you're on here right now before we get started.
That's right. Yes, make sure that you like and share. If you grab your lunch, whatever you may want to have a little taste for, and you can have your lunch and chat with us today.
Yes,
Chat with us today. And we definitely thank everybody for joining and taking your time out of your day, out of your busy schedule. I'm sure that it's busy. If it's anything like mine, or, you can have this moment to take a break for a second and just gather yourself, get some good information, have a good conversation, and also just get something that you can take in, something that you can share with somebody else. Share with
absolutely.
somebody else. Share with.
Absolutely. So please do. Ryan, do you want me to share the news?
So yes. So keeping up with KYHRC. On April the 15th, Kentucky Harm Reduction Coalition, as well as Vocal Kentucky, we will be collaborating and having a living room conversation with candidates. And so we will have some of our local candidates coming and joining in with us. Also, we will be utilizing this time to also have a kit making party to be able to partner in with us to our outreach team when we go out and do our boots on the ground outreach work. The kits that we take are naloxone kits, our testing kits, wound care kits, and etc. We utilize our time with our community to be able to put these kits together and have them readily available for our outreach team. Anything you want to add to this event?
No, I just want to encourage people to come out. Hey, Odell, we see you on there.
What's up,
So you
buddy?
popped in. We want to encourage folks to come out. We want to make sure. Hey, Jose, we see you in.
What's up,
Uh,
buddy?
we really want you all to come out. This is not like any other town hall. This is not like um, anything you've been to before. This is real talk right now. We want you there. We want you to meet the people who say they are going to represent you all the way from Metro Council to your state rep. We have about 8 or 9 candidates that are already slated to be in this space and share space with us. So really hope you guys can come out and learn about what we do. If you've never been to a kid making party, this will be an excellent opportunity for you to learn more about what we do here at KYHRC. If people who are joining us here, if you could drop your flyers of events, I know Odell has some things coming up. So if you could please put down um, the events and things that's going on locally. For national partners, you can share. Jose, he hosts a peer up session for people who are doing this work out in the community. Tap in. We got people in the field that join these conversations virtually, and they're holding spaces all over the United States. So hope you guys get a chance to drop some information in the chat so that people can connect.
And so this living room conversation will be held at Vocal Kentucky. The address is 723 South Brook Street, Louisville, Kentucky. The meeting will be at 4. It all starts at 4, and so um, for the members, as well as the conversation will start at 4:45 to 6:30. And so definitely come on out. We encourage you to come and join us for a good conversation, as well as some community building.
Yes, and the members meeting, you guys, that Ryan talked about, that starts at 4 o'clock. That's a very important space. So these are individuals who are most impacted by the policies, legislation. It's a mixed community of folks with lived experience, folks who have previously been houseless. There's folks who are, I hate the glare that comes on my glasses. We it's a mixed group of people, so it's a great way to learn about the work that we do and all the people who are connected to us. um, yes, leave a light on street outreach. Thank you for putting that down, Odell. We definitely want to make sure that you guys follow us and follow our friends and our colleagues across the state. Um, and I keep looking because Jose be distracting when he in here all in the comments, right? And then he has to go all caps. Uh, but yeah, I think that's all we got, right, Ryan?
Yeah, I believe that is it for right now. For right now, we always got something going on, but as of right now,
Okay. Yeah,
well,
Jose, we'll be sending out an email to you. Hopefully, this between this week and next week, you'll get an email because you are definitely on schedule. We want to get you out here, get you on here virtually with us to be a part of our conversation. So we
and
look
in,
forward.
and in fact, check your email, because we're actually supposed to be inviting you this month to be a part of our podcast. So clear your schedule. Thank you.
Yeah.
So for the month of April, Sharita, we are focusing and we are channeling as we celebrate diversity and inclusion.
Hmm.
And so some may even ask what is diversity, and what is inclusion, and how does that tie into harm reduction. And so today our topic is going to be harm reduction is inclusion and meeting people where they are.
Hmm.
Reduction
Hmm.
is inclusion, and it really is. And we're going to dive into this. And so we here about any means where we talk about real life, we talk about real survival, and we talk about real strategies that keep people alive and moving forward by any means necessary. So today's episode is going to be powerful. It's going to be necessary, and it's going to be honestly uncomfortable for some, for real.
Yeah, and that's how it is. So we're talking about truth today, and as we kick it off, it feels just right to dive right into harm reduction and our idea, right, of what inclusion is. I want to strip away some things first. I want us to dive into what is not. And what's so good and perfect about this conversation, you guys, is that Ryan and I had the pleasure of meeting with some administrators at one of our local high schools here, Jefferson County Public School. And we won't share the school, but we will share that how that conversation. It has a lot to do with this first piece. Harm reduction is not. When we engage schools and spaces like where the youth are, a lot of people come in with their own thoughts, their own biases. So we spent a lot of time unpacking um, what harm reduction is not. And the top one, especially for my people in the back, I mean, especially way in the back, right?
Hmm.
Encouraging drug use. Encouraging drug use. Ryan, why do you think people think that harm reduction is about people encouraging drug use? Why do you think that's a thing?
The word safe, safety, or safe use, or safe consumption comes up when people think of harm reduction, and and really it's not about us saying, oh no, here's a bag, here's some substances, we're gonna sit here and we're gonna watch you do it. That's not
Mhm.
what it is. That's that's not what it is. And if that was your point of view or your thought, we do apologize that we came to pop your bubble today, because it's really it encompasses so much.
Mhm.
And as we're talking about the inclusion part, it puts together different different pieces to make a whole.
Mhm.
I think I said that right. Different pieces to make a whole. And so harm reduction, it does not cancel out, but it does, and it doesn't add. It brings a happy medium, for a clear understanding.
Mhm. Yeah. And I think the more that we talk about it, right? Because some people might be like, wow, I've heard you all talking. Well, first, our platform and what we are about is going to be centered around the themes, around the foundational principles of harm reduction, around how we show up for each other in this movement. So understand that we're always going to come back to this, because every day in this work we're fighting against stigma, and stigma is grown out of these beliefs that people have that don't know. Um, yes, I see. Oh, we got some comments coming in there, Ryan. I believe it's just ignorance. Some people don't try to understand harm reduction, they just assume. Yes, there's a lot of things. A lot of people are assuming that it means lowering standards, that it
Mhm.
means giving up on people. You know, those I love that you brought up the language of safe use, safe consumption. What's the difference between me going to the restaurant and seeing at the bottom of one of the menus, consume alcohol safely? Is that is that not? I mean, if I don't drink alcohol, I'm not going to go, "Hey, come get this menu," because
Right.
you are encouraging me to get something to drink.
Okay.
Like that doesn't make sense, right? That's
Right.
what I think. And Jose, you want to read what Jose said?
He said, "I understand why people think that is what it is, though, because for me, I have something against people who entire career is based on soundly legalizing drugs and having only drug related messaging because it takes away from community issues. People took drugs and ran with it."
Mm,
Wow.
that's deep, Jose. I don't know if our audience ready for that conversation, dude.
Okay.
Like, I mean, but that's that's true. We are still dealing with some of the things that people do unintentionally that turn around and it harms the work that we do. Right? It harms when people are just sending a message and perpetuating. So oftentimes we have to start conversations by saying that harm reduction is not exclusively about people who are using drugs. Honestly, this is the way that I can bring it all the way down to a baseline understanding. What we're saying is that drug use, a person's drug use should not exclude them from access to anything.
Right.
That's actually what it is. We should not be saying a person because they use they don't deserve fair housing. They don't deserve respect. They don't deserve to be respected by HIPAA compliance,
Mm. Yeah.
right? Um, oh,
And
did you want to read some or you go
and
ahead?
and if the approach excludes people at their lowest, if the system only works for people who are already doing well, or if your help requires perfection before
Mhm.
support, then that's not operating in in inclusion, that's
Mm-hmm.
actually control. That's
Mm-hmm.
actually manipulation. That's actually misleading, because as we break this down, it shows where there is a divide,
Mm-hmm.
and everyone is not included. And if you don't have this set of criteria, then we definitely cannot help you.
Mm-hmm.
Even when we think about how, for what is it? Shucks. Grandparents like Medicare, getting their monthly payment, their disability
Yeah.
and things of that nature. Having to have to be able to stick within certain stipulations of time for working.
Mm-hmm.
If you don't have that, or if you exceed that, then we're knocking you off.
Yeah.
We're cutting off your benefits because you don't fit in this criteria any longer. SSI, thank you, brother.
Mm-hmm.
Being able to, you have to stick within these criteria in order for us to help you, and
Mm-hmm.
that's not inclusion. That is drawing a line.
Yes, I love that. Thank you for that. But we could talk all day about what harm reduction is not, right?
Mhm.
We can do that all day. But we're going to move to, because I want you to hear what it is. And that's what we did today, talking to this school. It's keeping people alive, like what Bree says at the top, right? And
Yeah.
Bree, to your point, you're absolutely right. We keep them alive, and then what, right? But keeping people alive, primarily, keeping people healthy, keeping people healthy. When I know how to use something properly, then I feel empowered. I feel like I can do better. I can move better. So that's that
Mhm.
healthy people piece. Reducing risk. When we talk to them about the syringe service program, right? Our
Mhm.
group this morning didn't have the reaction that most people do. But a lot of people, they cringe when they hear about syringe services programmings, or the older terminology is the needle exchange. And it's always interesting to me when I'm asking people to share, why do you think we're here, and how far removed, especially here in Kentucky, when there was national news made
Mhm.
when the small town in Indiana had that very large spike. Remember that, in HIV
Mhm.
transmission rate? I'm sitting here like, so we're not putting together. Critical thinking skills has been removed out of our educational system because we got to put it together, folks.
Right.
So we're reducing risk when we provide those kind of services. Yes, there are potential risks if someone is smoking crack through a pipe. Like, people are like, well, what's the point of a pipe, right? If someone is burning their lips, if they're not good with oral hygiene, like all the problems that can arise, and we're
Mhm.
not talking about it. Like, you know, let's talk about meth for a second, because a lot of people don't understand.
Listen.
Right? Like, listen. But you all see Ryan's beautiful smile. He's disclosed his recovery walk. You all see how
Yeah.
beautiful his smile is. And I like to tell people that, the fear mongering that our country has done, like what someone said in the comments, the government's messaging, right?
Mhm.
The fear mongering. Who all remembers the pictures, the faces of meth?
Mhm.
Oh my God. I mean, it just made you think, as soon as you hit that mouth, your teeth coming out, your face. I mean, it just, even though it was a progressive,
Yeah.
but what they didn't share was life skills. So if you talk to Ryan, he likes to take care of his oral hygiene.
All the time.
And
Okay.
why and when you're using substances at times, you may miss out on certain hygienic
Yeah.
practices.
Definitely.
So when you look at a meth mouth, it's not just the drugs.
That part.
It is the drugs, and
Yeah.
right? So it's getting people to understand the risk of any use, the risk of take. Do y'all know what kind of risk you can put yourself at if you taking Pepto Bismol every day, all day? I'm just, I'm just asking. Do you know that you can mess up, right, your digestive system?
Yeah.
Your digestive system, your digestive tract, the risk of taking ibuprofen all the time, the risk of taking what is it, Tylenol,
Hmm.
aspirin. You need to even tell the doctor if you take an aspirin regularly before you have surgery. Come on, you guys. This is harm reduction.
Yeah.
Education. The last two, building trust. I like to say it's clinical skills and practice for clinicians out there, people who work in treatment and recovery spaces. Thank you, Kristen. Thanks for joining us today. Um, People who are in the clinical practices, you know, this is where you get to actually work on your skills of rapport building,
Hmm.
building rapport with people. It don't always happen behind the door of your office while you're sitting at your desk. The best work is being done out in the street. And then the last one I want to point out, and there's a list of more of what harm reduction. I got a bunch of harm reduction is. Everybody that's in this chat right now sound like y'all better be sharing this stream. I know that much. Y'all better be sharing out here. Y'all just chiming away. But please share. Creating access without judgment.
Yeah.
You know, people tell us a lot. I mean, Ryan has had people reach out to him in his, his DM asking questions. People tell us a lot because we're not.
We thank you, Jose, for joining us
Oh
today.
my God.
We appreciate you.
I want to thank everybody that's on here for joining us today. But just that reduction of feeling judged. I can go talk to you about this honestly. I can talk about where these sores are coming from, and you not look with me and turn your nose up and act like you don't want to touch me. I can talk about the things that I'm involved in. It says you don't have to be perfect
Mm,
to deserve care.
mm.
You don't have to be perfect.
And,
Go ahead.
we could spend a lot of time on that.
Mhm.
With, our city has experienced a lot of that in the healthcare
Mhm.
system. Because we've had some stories of we love you too,
We love
Bree.
you
Thank
too,
you.
Brie.
We have experienced, and we've seen on the news, so it's no secret. But people that may be going in for some care into the hospital, and it is drug induced or substance
Mhm.
induced, and then because of them being under the influence, I've seen videos of people literally being rolled right out of the ER and left on the sidewalk after being seen and realizing that there is that they are under the influence, or they have some type of substance inside of their system.
Right. I love that Jose shared there's a lady out here who made an HCV, which is hepatitis C, HCV virus, hepatitis C virus campaign called Know Your Worth. And her motto was, You are worthy.
Yeah.
That feels so good when someone can acknowledge and see you,
Hmm.
right? That's a beautiful space to be in. As you were talking, uh, Ryan, I was thinking about how many people get missed, but then I started thinking about myself. I want to know, you guys, how many of you have gone to the hospital, or you second guess going to the hospital, and because you didn't want to be identified as drug seeking, or because you're in real pain, right? You're really in pain, but you know the system, and you just decided I'd rather not even engage because I don't want to deal with that judgment. I've struggled
Yeah.
with wanting to go, especially when I had a nurse practitioner who, my previous nurse practitioner, who is a retired, she's a veteran, and she's a nurse practitioner, and she was dealing with a serious medical issue, and she was being treated like she was a drug user. or a drug seeker. And I know there's a lot of us that experience that. So when we think about it, when people say, well, I don't know why people just don't stop or go get help. If, some, if someone is judging you the moment, not even before you enter the building, they
Right.
see your name on the list.
Yeah.
They see pain. They see pain as your indicator.
Hmm.
That's that's what we are trying to work against.
Yeah.
We want people to get the help. We know that there are medical practitioners out there that have a lens of harm reduction and how they move, and we partner with so many different people. And our team is real living people. These are not robots. So if I have something that I'm dealing with, we did this before, didn't we, Ryan?
Hmm.
Someone was concerned about a diagnosis they received. They got two different diagnoses from two different hospitals, and they were very concerned and scared. What did I do? I went to my team and said, "Hey, y'all, I need someone to go to XYZ." And
Yeah.
people started giving me information. Why? Because it's connected to community.
Yeah.
Because I could trust where Ryan's sending one of our participants or a person who's just reaching out because they're scared.
Right.
And thank you for sharing that, Bree, that you've experienced that. Have you experienced those feelings yourself, Ryan?
Not per se for myself, but dealing with my mom, my late mother. She had stage 4 metastatic breast cancer,
Mm,
and they were giving her Dilaudid, and to in the like the final stages of her life, and they were giving her Dilaudid, and she had completed her
mm,
prescription a day before,
mm.
and I think I've shared this before. I cleared the whole counter off, um,
Yeah.
after having been judged through the window, and then I came inside. My Taurus horns came up, and so I'm going inside. My mama need her medicine, and she's in pain, and
Hmm.
and yeah, the way that I went about it, I shouldn't have. I did. They did call the police and everything because I went in there and I cleared the whole counter off
You
because
was that was good trouble though.
it was good trouble because you're saying the pharmacist asks, well, why does your mother need this Dilaudid and she is a day early? And he simply asks, is she addicted to these or is she selling them?
Oh,
Yeah. So, which is why I
woo.
went in and I swiped everything
I
off of
would have
the
cleared that counter too. I would have been like, y'all done lost y'all damn mind. I mean, well, I have. Trust me, I've advocated for plenty of folks in my
Yeah.
life.
And
Oh
it's
my
sad that,
gosh,
yeah.
Ryan.
And just to have that happen, it gave me a bigger lens to look through, and this was all happened before I even knew what harm reduction was, knew what really knew what it entailed, and knowing that there are people that are out there, there are elderly people that are having to deal with this, there are young people that are having to that have diagnoses that require them
Hmm.
to take narcotics, and guess what, they're having to, again, those requirements, those things that we have to, those criterias that they set,
Hmm.
that supposed to be able to protect people from that, but yet you're harming them in the process.
Yes. I'm thank you
Yes.
for sharing that. That's heart wrenching, and absolutely, you had every right to clear that damn counter and some, right? Um, Jose shared a story too.
Mm-hmm.
Let's sit with this. His ex's uncle needed a liver transplant.
Mm.
He has a drug use history, and at this time was on methadone. They dead ass denied him the liver that they had, and he died the next day.
Wow.
Do you know
Wow.
how many stories actually end up like that? Well, I'm gonna tell y'all, it's not called the healthcare system. Everybody that knows me by now know that I call it the sustained illness. After my doctor let me go 2 years with a
Mm.
flag high, borderline A1C, and told me
Mm.
it wasn't nothing to be concerned about, So you gonna wait till I need to be on some medication?
Till I fall out somewhere.
Right. And then you say, well, your sugar is just too high to control. No, baby, I'm bringing that sucker down. Now, I
Yeah,
still got my sugar issues, but I bought
definitely.
that sucker down. You ain't need the cosign on that. But just hearing these stories, you all sit with that. This
Yeah.
is real, what we're talking about. So when you think about people who are battling personal things, everyone has a reason. Come on, let's just go into it. We talking about inclusion. Let's
Mm,
just go into it. Harm reduction means reality, not the fantasy. And the reality is, y'all, we live in a drug using society.
hmm.
We do. And when I asked the students at U of L that I was working with, I did a class this week. It was absolutely amazing. It was a 3 hour class, and when I tell you these new clinicians that's coming in the field, they ready, baby, they ready.
Yeah.
But I asked them, I was like, what is the number one substance that has no cap, that has no regulations on it? You can get as much. You can walk in the store. You can get as much as you want. And of course, naturally, most people go to alcohol. And I say, nope, 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 nope. Alcohol had to go through a prohibition thing. That's not it. It's sugar.
Hmm.
Other countries, you guys, look it up. Look up. And for youth that end up watching this, because some adults, they'll be like, y'all can go to y'all AI. I know y'all use AI. It's okay. AI is part of the community. Live with it. Okay. We've been using AI. Just a side note. I'm
Okay.
I'm I'm generation. What am I? Generation X. I'm a Gen Xer, and the internet, AOL, dial up. When we started implementing having computers in our homes, we were
Yeah.
already dealing with data centers. So that's
Hmm.
my talk. Y'all can take it how you want it, but I'm just letting you know it ain't going nowhere. All right. But those that do use it and you openly use it, just put a question in there, right? What what countries, what countries is sugar regulated? And you'll see all those countries. You'll also see that they're not dealing with things like diabetes.
Right.
And we got type 1 and type 2 diabetes. Well, did you know that they've just started releasing more facts and more data around the fact that the third type of diabetes is what is called Alzheimer's? They're starting to link that. So I'm like, we got all of this information, all this data around sugar, and sugar is very addictive. I
Yeah.
mean, I love French fries. Guess what them carbs turn? Guess what them potatoes turn into? Sugar. I love potato chips. I love rice. I love all the things that turn into a sugar.
Yeah.
So we are built in a capitalist society where someone has to be on top and there has to be people on the bottom for people to be on top. And people have to be sick so that our hospital industry can continue to make money and our insurance industry can continue to make money. There's a reason why some insurance will pay for something and another one will allow you to die. Literally.
Yeah.
Jose's not the first one I've heard say that. So we're talking about inclusion. We're talking about the fact that we include it all. Everybody says they're inclusive
Until.
until what,
Dun, dun,
right?
dun,
When do people start
dun.
saying I'm inclusive, but what's the first one? I think
Until someone relapses.
so. They done went through treatment. They done I'm inclusive, but if they use, they out of here.
Out of here.
And I'm sitting there like, okay, so let's go with the disease concept. Because that's how I was trained in substance use disorder, right? The
Hmm.
disease concept. What you mean you out of here? If the substance use disorder is an illness,
Yeah.
you just gonna throw me away because see, I can't say nothing to you about the fact that you got to use insulin, you got to stick yourself. See, I can't do anything like that with you.
Mm.
But
Wow.
if I return to use, now it's problematic and something's wrong with me.
Hmm.
I'm inclusive, but someone refused treatment. You ever
They see.
refused treatment before?
Uh,
Right.
I did once, and really, I learned from that because of the simple fact they did not throw me away. They
Mm,
actually found a way to be able to make it work for me, because
mm,
again, this whole recovery piece, it is structured individually.
mm-hmm.
It's instructed. It is. It's built to and it be an individual concept. Even though it has a broad view, it has an individual concept that is structured just for that person.
I love that. That was a great
Yeah.
experience.
Yeah.
Listen, now I have to own, and I'm gonna be honest. I feel like I'm a confessional, but you're an elder, so I could do that. I remember how we used to identify people in documentation at different treatment programs when they refused.
Hmm.
You know, that impacted people's ability to get their children back in their custody.
Yeah.
Some people lost their rights. I was a part of I was a part of a system that was very punitive. And
Hmm.
when someone refused treatment, it became like a big stamp on the forehead. Now they use that the term that I pushed back against when I was working in DUI.
Okay.
The term is they're non-compliant.
Oh yeah.
And I've encouraged and discouraged the use of that word from our uh, our clinical spaces. You know, yeah, being a mandated reporter, oh gosh,
Mm.
is very tricky, right? Because what does that mean? And I think what confuses people with us as harm reductionists is that this is where I think that idea of you just let people get away with stuff, right? Because we're saying openly, that's a tough space to be in. You know what's tough about it? And Jose could probably, you know, can attest to this. He's probably typing right now to beat me to the.
Okay.
But what's concerning and why we pause as harm reductionists, as people who lead in this way, is because we know the system
Hmm.
is not a model of restorative justice. We know that.
Yeah.
I was a mandated reporter when I was in a shelter and had to talk people through how to write things out in ways that won't permanently fuck up the individual or the child's life
Mm.
or safety. Yes. So there's a way as harm reductionists that we can utilize that system as well. And thank you for sharing that, Jose. I've worked with a lot of people who are case managers and clinicians. This is probably that area, right? How do I navigate my role? But there are
Mhm.
ways that we can support you in doing that.
And that's one of the this is also included. I've recently we went and to participate in the peer support training, and this goes along with this. The peer support actually is the one that can help advocate in this type of conversations, in this type of understanding, because they are there to help, one, to help guide you through, and being able to understand where you are, where you can be included into this, and be able
Mm,
to take you step by step on how to be able to navigate through the systems, because they, again, we they when once you have that stamp or that stigma stuck to put
mhm,
on you, it is hard to get off. Just like a your charges, it's hard to
mhm.
get one. It's easy to get them on there, but it's very
It's hard to
hard
get them
to
off.
get them off.
It
Yeah.
really is. That was a great note. Thank you, Beth. Thank you, Jose, for sharing more. And Beth, yes, good point. DCS is moving the goalposts all the time. Hey, I witnessed that
Yeah.
all the time. Talk about non-compliance. They come non-compliant with their own policies, if you ask me. But that's another story for
Okay.
another day.
Another topic for another
You're
day.
right.
And even with harm reduction and inclusion, it answers, who are we leaving out?
Yes.
Who are we leaving out? It includes that we include people who are still using.
Mm-hmm.
We include people who aren't ready. We
Mm-hmm.
include people who don't trust systems. We include
Mm-hmm.
people that we include people society has given up on. We include the people that are seen as being the low on the totem pole, that don't nobody want to talk to or assist or help, or they you can only come at this certain time. Inclusion without harm reduction is conditional.
Mm.
It's conditional. And who wants to go and be assisted by somebody who is only going to see them in a conditional viewpoint,
Mm-hmm.
and is going to have all of these stigmas, going to have all of these viewpoints, and not seeing really what's going on, but you see everything else.
Mm-hmm.
You see everything else. You see the stuff that's wrong. You see the stuff that you don't particularly care for or like. And then so now I'm unavailable to you.
Right.
And
Whew.
don't push me off.
I
Okay.
thank you, Ryan, for that.
Yeah.
That was really good, and a really good segue into people understanding why. Because I think that the problem is people don't understand why. A lot of times when I would hold a family group in clinical practice, the families would come in and just be like, why can't they just stop? Why can't my daughter stop? Why can't my little cousin? Why my son? And there's a lot of things. We had to just say no. It didn't work. That was the war on drugs. That was Nixon, Reagan, all of the big ball players for the war on drugs with the bogus ass DEA. Okay? Because I'm telling you, like I said earlier, if I had 50 plus years in a row and I still couldn't win the war, I would be fired.
Yeah.
The war on drugs been going on for over 50 years. And we're worse. We're worse. Right?
Definitely.
So when we think about why people don't just stop because they're told to, they're
I
threatened
didn't.
to, or they're shamed to.
Mm,
Did you stop because somebody threatened you, Ryan?
not at all. Not at all. and,
I'm-
and in fact, my grandparents, I love my grandpa. Me and my papa are like this,
That's all right.
and it was the fact of him having the thought after, and they told me afterwards that they had binge watched Intervention, and so they had binge
Please
watched.
tell me that Papa was not about to do a whole
Ah,
intervention.
yes, yes, yes. But part of this intervention, though, he does carry, and it was actually to the point where I told them that, and I've never cussed at my grandfather. I've never disrespected him. And this particular one day, I was inebriated to the max, and they were telling me that I had to go, and I told him, well, y'all don't tell me what to do, yada, yada. And he put his hand on his pistol.
Mm.
I just turned around and I walked on out the door and I left the conversation. But that's why it is so many pathways in recovery, though.
It is.
And people don't really understand that.
But
They,
what I tell people, Ryan, is before we can even get there, we have to address the issue that a person is presenting with. So
Mhm,
if someone, why people don't stop, the first thing is people don't stop because of threats, shame, guilt, and pressure, right?
mhm,
People are dealing with, including our youth, people are dealing with trauma,
yeah.
poverty, mental health struggles, systemic barriers, survival, complex and complicated trauma. I always think about, it's funny, you'll see parents rallying around cases they see on the news or on social media. If a veteran was killed, if they was displaying some type of, PTSD. But if a youth go out here and they murder someone, or something happens to a youth, or they carjack someone, now you got all these adults who are pointing the finger at the youth.
Mhm.
And I'm like, you know, as a kid, like I grew up on the south side of Chicago. I wasn't fully in the neighborhoods when the violence was as prominent.
Mm,
There were parts of my life where I lived in Inglewood. There were parts in my life that I lived in Hyde Park, over east off of Lake Michigan, and out south in Beverly. Has there been violence in different spaces that I've been? Absolutely.
yeah.
But the trauma of living in a situation where you're under resourced and underserved, where you don't have access to basic life needs, and your income to debt ratio is ridiculous, it's insane, right? You're making minimum wage, and everything that you have to do to live is never going to be covered by one job.
Right.
So when you're thinking about all of those things and having a youth that has to witness violence or always hiding every day or running, from school to home to make sure they don't get caught in crossfire if there's a gang war going on. These are things
Mhm.
from home in Chicago, right? If you're growing up in that, you have complicated, complex trauma because there's no way in the world that that's a normal way to live.
Right.
So you
Right.
got these issues going on. For many people, when I teach about substance use and prevention, many people, substance use, that's the symptom of it. So there's coping. It's the great escape, the
Yeah.
temporary but great escape, the pain management,
Hmm.
the survival strategy. Like, I'm like, let's normalize it. What I would tell my clients when I would do treatment classes and relapse prevention, I'm like, how many of you guys have watched Law and Order? And they'll raise their hand. And I say, what happens after they win a case or lose a case? What do they sometimes do? Well, sometimes I've never seen nobody in their office do this, but they'll pull out a bottle out their desk.
Hmm.
If they lose a case, they'll end up at a bar. And they do something that a lot of people don't get a chance to do is they end up with the whole bottle right there and pouring themselves shots, which
Yeah.
is unrealistic because bars are not allowing you to do that.
Right.
Right. So I'm sitting here like, if we normalized how alcohol has been used to cope, why are we so edgy about the fact that there's other substances that give people the feeling they're looking for, whether it's escape, whether it's to numb the
Hmm.
issue, whether it's like real pain management.
Yeah.
So when the system says, come back when you're clean, come back when you're done with that, or like our
Uh,
treatment spaces, come back when you're ready to work on yourself. What people hear is, come back when you're not struggling.
mm,
Come back when your struggle is over. And that can be never. If a person is born into a system of crime, violence, drugs, alcohol, no positive outlet, what do you think is bound to happen? They don't see all the things that you see. This is why we talk so much about meeting people where they're at, is understanding who that person is so that you can walk with them towards the success point, not your success point, but theirs, helping them identify what success looks like for them.
so what you just said, it actually leads us into our next part, talking about what meeting people where they are looks like. So
Mhm.
bringing this to a practical part, because we got what 11 minutes left. So
Mhm.
bringing this and putting this in a practical standpoint, meeting people where they are. It looks like providing clean supplies without the lectures. At our sites,
Ooh.
we don't ask you what are you utilizing this for, what do you need this for. We don't ask none of that. We don't even take names anymore. We get demographic information, but we don't take on any extra because it don't need all of that.
Mhm.
Offering services without requiring sobriety.
Mhm.
It's putting a mandate on them, and that is being put on them, and not it's not being suggested.
Mhm.
Um, even using language that respects dignity,
Mm-hmm.
making sure that someone's dignity stays intact once you finish, providing services or doing whatever. Their dignity, they still need to be able to walk away from that with their head up high and not held down, or walking away with it in their arms,
Mm-hmm.
because sometimes these systems can take it to the point where you just feel like there's nothing else left to do. I
Mm-hmm.
can't go nowhere else. That it's meant to make you feel like that. Also, building relationships before expectation
Mm-hmm.
allows that trust factor to be built, and be able to, feel comfortable, in knowing I can trust this person. This person is not going to lead me
Mm-hmm.
into any more harm. They are helping me. They are providing me with something. And then also listening more than directing. One thing that that stood out to me the most in this peer support training was that, a lot of times, if they just want a listening ear, but not only are our participants needing a listening ear, they need that listening ear because it is actually, a lot of times they talk themselves into their own solution.
Mm-hmm.
We can talk ourselves into our own solution. And so it means asking, what do you need right now?
Mm-hmm.
What do you need from me right now? Why aren't you, and why, and instead of why aren't you doing better? Why
Right.
just did you stop? And so flexibility allows us to be able to take baby steps, take small steps that'll lead to the bigger ones. Um,
Mm-hmm.
Progress is not linear. If we take it one step at a time, that's why the motto is one day at a time. Just take it, just dealing with just that one day at that moment, at that time, and then letting it let that allow you to set up for the next time.
Mm-hmm.
And then trust takes time. I don't trust people too often. And I see you, Jose. being being able to trust somebody is big
Mm-hmm.
in recovery, because their trust has already been lost by everyone else that they have already encountered
Mm-hmm.
before getting into treatment or recovery.
Mm-hmm.
And so we don't move people forward by rejecting where they are. They have to come from somewhere. There has to be a starting point. You just don't go and get in the race, but you automatically at the end. No, you have to go through each phase of this race and this journey called life.
Mm. Amen. I know that's right. I know, right, Jose? He be trying to take it there. I hear him. Yeah, he can't help himself.
Okay.
But yeah, I appreciate you sharing that, and I'm gonna lean in to the people who are impacted. Right. I needed folks who are in the work of social services, who are clinicians, to hear what Brian just shared. Reach out to, because he trains as well. Right. But I want to talk to the people who this is impacting. So if you're a person who uses a substance, who's recreationally using, who uses anything and has felt the harms from society and culture and the community, I want you to hear me with this, okay? I need you to take a chance. We know about the system, and the systems are built on compliance, control, eligibility requirements, and abstinence only model. We understand that. And when you come to speak with us, like harm reductionists, we can help and support you navigating. So, no, we can't create a new hospital. We cannot create a new hospital for just people who know how to practice from a harm reduction lens. But what we can do is help you navigate the systems, because the systems aren't going anywhere. Harm reduction, the work that we do, challenges systems by asking, why do people have to qualify for care? We ask them the tough questions. Why is survival conditional?
Mm.
Why is relapse treated like failure instead of part of the process? We come into those spaces to disrupt the harm so that you can access your care through your primary care physician. We also educate. We live in a society where punitive responses to drugs is real. So we explain why a person, when I worked in DUI, all I did was talk about why you are here and what you can do to be empowered to make better choices so you don't land in a space that you don't want to be in.
Mhm.
We have to take some accountability and ownership. But the best way to do it is to learn the why. I don't mind people saying, well, why is it bad for me to do that? I like when people ask me those kind of gut questions because now I can unpack your belief system around something being bad. Drugs in and of themselves is not bad. It's not. We use them every day. Some of us have to take a pill every day because their ADHD will be off the chain.
Mighty God.
So we don't say inherently drugs are bad. We talk about how we use things and how it impacts our body, and it comes from a health informed space. Jose said, what harm reduction is too is if you're going to meet people where they're at, you need to be educated. You need to be knowledgeable.
Hmm.
You need to understand. But on the other side, if we're doing this work and you see us trying, it's up to you to take a risk and take a chance. I know you can do it.
Yeah.
I know you can do it. Systems weren't designed for everyone. And we know it shows. So harm reduction is the disruptive work. That's what we do.
Yeah.
You guys, we gotta shift and move, right? Because we gonna stay on this all afternoon. And we are supercharged. We had such a very powerful meeting
Yeah.
earlier where we actually did some of this stuff, Ryan, where we did shifting from judgment to compassion, right?
Compassion.
I think we hit all of them. What do
Yeah.
we need to shift, Ryan? What are the things that we need to shift?
From judgment to compassion,
Mm-hmm.
and shift from punishment to support.
Mm-hmm.
They need our support. From control to autonomy,
Mm-hmm.
allowing people to guide themselves, and even from perfection to progress.
Mm-hmm.
There has to be a starting ground, and this applies to the providers, organizations, communities, and
Mm-hmm.
even personal relationships. And so if your help disappears when people struggle, then it was never real support in the beginning.
Mm-hmm.
And for real, the commitment to say to somebody, I see you. I see you. Even if you're speaking for multiple people, our organization, our agency, we see you. You matter right now, not
Mm-hmm.
tomorrow, but right now. I don't care we don't care what you may have experienced before now, but right now you matter. You don't have to earn your care. You are worth the care. And so I challenge you here this week to take a moment and reflect on who am I unintentionally excluding?
Mm-hmm.
Where am I requiring perfection from somebody instead of progress?
Mm-hmm.
And how can I meet somebody where they are without judging them? Because at the end of the day, we don't save lives by setting conditions. We save lives by showing up any kind of way, by any means. Listen.
Y'all, this episode again, we could go on and on. Donald Davis, our co-founder, has joined in to catch the last few minutes of
What's up,
our chat.
Donald?
I'm so glad you were able to join in, Donald. We're gonna have to bring you on at some point so you could chat it up with us, so people can learn the history behind why this organization became your mission and your goal.
Yeah.
Our next episode is 2 days after my birthday, so everybody better show up on here. Uh, Thanks, Donald. That's your homie. He was my homie first, though, Jose. If this episode spoke to you, share it.
Yeah.
Start a conversation, right? Challenge systems. And remember, meeting people where they are might be the very thing that keeps them
Keeps them alive.
alive. Thank y'all so much. See
Thank you for
you next
joining.
time.